Welcome back to Radiology Insights. Imagine a diagnosis that changes everything, a condition so rare yet so devastating. Welcome to the world of lethal dysplasia, a congenital disorder that affects the development of unborn babies. It is a condition where the skeletal system fails to form a properly, leading to severe implications for child's survival. As radiologists, we play a critical role in identifying these abnormalities, often changing the course of pregnancy and parental decision making. In this video, I will discuss precisely the lethal dysplasias, exploring its types, specific findings, from prenatal screening to postnatal care. We all examine the radiological findings that help us navigate this complex condition. Join me as we shed light on this critical topic, providing valuable insights for the healthcare professionals and families alike. Lethal skeletal dysplasias form a heterogeneous group that is commonly characterized as being non-survivable for prolonged periods ex utero. Lethal dysplasias have been classified into some major categories, and the genes responsible are known for several. They include campomelic dysplasia. The findings are hypoplastic tibia, scapula, and vertebral bodies, pear-shaped iliac bones, long femora that are entirely bowed, and deficient ossification of the pubis, radial head dislocation, pulmonary hypoplasia, and laryngeal and tracheal stenosis, urethral stenosis, thoracic platis spondyli and kyphosis, multiple cutaneous dimples in the arms and legs. This is the X-ray showing 11 pair of ribs, hypoplastic scapula, bowing of tibia, fibula, narrowing iliac wings. Next is thanatophoric dysplasia. The findings are clover lip skull, very short ribs, small scapula, sphere platis spondyli, U or H-shaped vertebrate bodies, small iliac wings, horizontal acetabular roof, small sacroiliac notches, bowing of long bones, French telephone receiver femurs. Most common form of the skeletal dysplasia that is lethal in the neonatal period. Severely dysplastic bones, large cranium, shortened limb, bones with bowing, short ribs, and platyspondyle. Next is achondrogenesis. The findings are poor mineralization of the skull, absent or minimal ossification of the vertebral bodies, short, thin ribs, multiple fractures, deformed and short iliac wings and long bones, absent ossification of the pubis. These are the findings. The comments are micromelic dwarfism, polyhydramnios, and fetal hydrops. On X-ray, no vertebral body ossification, shortened long bones, hypoplastic iliac bone. Next is homozygous achondroplasia form. The findings are short long bones, flat vertebral bodies, large skull, and the comments are radiographic thanatophoric manifestations lie between the dysplasia and heterogeneous achondroplasia may be diagnosed in the second trimester. On imaging, sphere long bone shortening, protuberant abdominal, small thoracic cage, and macrocephaly. Next is asphyxiating thoracic dysplasia, also called June syndrome. The findings are small thorax with short bulbous ribs, small pelvis with short flared iliac bones, trident acetabula, infrolateral spur adjacent to the sciatic notch, cone-shaped epiphysis of the hands. The comments are spectrum from lethal to latent forms, renal, hepatic and pancreatic dysplasia, medullary cystic change of the kidneys, renal dystrophy. On X-ray, narrow and elongated thoracic cavity. Next comes the osteogenesis imperfecta type 2. Findings are very little ossification of the skull, vermian bones, beaded ribs, short distorted long bones, multiple fractures, flattened acetabula, and iliac wings. The comments are blue sclera type 1, 2, 4 have better prognosis. On X-ray, numerous horizontal lines, zebra stripes, multiple fractures. Next come the Chondrodysplasia punctata rhizomelic type. The findings are symmetrical rhizomelic shortening of the long bones, punctate calcific deposits in cartilaginous skeleton, and the comments are approximately 50% may survive up to 6 years, other types have better prognosis. Next come the hypophosphatasia lethal form. The findings are partially ossified skull, no ossification of the vertebral pedicles, short abnormal ribs, bent and unusually shaped long bones, spurs in the middle portion of the long bones. Blue sclera, infantile, lethal, childhood and adult types. Fetal type on prenatal ultrasound, failure to observe after head by 16 weeks gestation. On X-ray, wide metaphyses with irregularity, absent ossification of the epiphyses, render ribs. And the last is short rib polydactyly syndromes type 1 and type 3. Findings are hypoplastic mandible, horizontally oriented ribs, short long bones, dolichocephaly, iliac bones, and flattened acetabular roofs. Types range from lethal to more mild forms. Type 2 and 4 have near normal pelvis. Polydactyly is sometimes absent in types 3 and 4. On X-ray, short ribs, narrow thorax, post-axial polydactyly, short limbs, and platyspondyly. Thanks for watching. If you found this video helpful, don't forget to hit that like button and subscribe to Radiology Insights for more content on radiology.